Hello, my name is Sasha Oden, and I will be discussing the importance of the access to mental health services for military members and their families, specifically those stationed overseas. Military members and their families experience a very unique way of life, with frequent moves and distance between them and their support systems. Moving overseas adds an additional layer to this already stressful way of life, specifically with the potential culture shock that comes with moving to a new country, adjusting to a language you may never be able to speak, and feeling isolated. Unfortunately, access to mental health services is inconsistent across different military installations, leaving families struggling to find adequate support when they truly need it. Depression is the most prevalent mood disorder in the military population, with an estimated prevalence of up to 21%. With limited resources and lack of treatment, this can evolve into debilitating PTSD and suicide. According to the Department of Defense, suicide rates among active duty service members has increased by 40% between 2015 and 2020. There was an increase of 15% in 2020 alone. I see that as a need for change within the military culture and the services offered to families. Research indicates that the two most common stigma concerns in regards to reaching out for mental health assistance are, quote, my military leadership might treat me differently, with 44%, and, quote, I would be seen as weak at 43%. The lack of resources and leadership support has caused the overall well-being of the military community to decrease. Workforce shortages. This is based on my personal experience as a military spouse looking for mental health assistance and my experience from my current field placement. For those who do not know, I am placed at a private practice that aids in treating the military community and their families in Stuttgart, Germany, as well as veterans and contractors who work and live overseas. My field placement is the only primarily English-speaking mental health practice in all of Europe. We are sent referrals from the military bases, the VA through Centerstone, and TRICARE. With only 5 providers, 3 of which being interns, it is impossible to accommodate the surplus of individuals seeking mental health treatment in a timely manner. Since there is limited mental health professionals, there can be longer than expected wait times of up to 4 weeks before patients are able to be seen by a provider and complete an intake. By this point, the main stimulus that started the cause for therapy has passed, and some patients don't see the point in waiting. Even if patients were referred off base, there is still the language barrier because, at least in Germany, most providers don't speak English, or if they do, they speak very little. So it's kind of hard to bare your heart and soul to someone who's unable to speak your language. I think the best way to combat this shortage of mental health professionals is to offer incentives to serve those who serve. One incentive being student loan forgiveness or some form of assistant payment plan to help those who are interested in providing mental health services. Another incentive would be tax credits, which would make the position more enticing. A great way to create a pipeline for professionals is to partner with universities and social work programs. This can guarantee graduates a placement for internship and a job post-graduation. To address these concerns, we must advocate for increased federal funding for mental health programs on overseas installations, establish federal grants for counseling services that provide multilingual and culturally competent support, and implement mental health education programs to reduce stigma and promote early interventions. By securing consistent funding and resources, military families can receive the support they need regardless of their location. Mental health support for military families stationed overseas is not only essential for individual well-being, but also for overall military readiness. With adequate resources, incentives, and increased funding, we can expand access to counseling services, address workforce shortages, and improve mental health outcomes for both service members and their families. As future social workers, it is our responsibility to advocate for these changes and ensure that military families receive the support they need, no matter where they are stationed. Thank you for your time.